so we'll start off. I'll just show you how you go into the DEA manual. So that is the manual that you want to make sure that you read at least once before taking the MPJE. And of course, the controlled substances is one of the most important chapters that you really want to get a hold of and really understand before taking the exam. All right, so when you go to the google.com, just write DEA Manual right there. And the first option right here, that is what you want to click on. And it will bring you to the website for the DEA. So you want to scroll down, all down to the bottom, and here is the PDF that you want to click. All right, and here is the pharmacist manual. This is a very important thing to read, like I said, before taking the MPJE. And so what is the DEA? What does that stand for? So DEA is Drug Enforcement Administration. And as you can see here from the very first page, it's a part of it's actually under the Department of Justice. So the Department of Justice in the U.S., they created the administration called Drug Enforcement Administration. And that is usually controlled by the Attorney General. And what is the purpose of the DEA? So basically the DEA is responsible. We're going to have that in here in the preface. So the DEA is actually, the main responsibility is mainly to prevent diversion. Of course, that's for sure. So to prevent diversion of controlled substances, that means just like people, selling controlled substances and so. And then, of course, to prevent the abuse. So if you prevent the diversions, then you prevent the percentage of abuse of that medication. And then ensure an uninterrupted supply to those who need that medication. If it's going to be medical, for medical use, scientific, or research needs. So these are the main goals for DEA. And the Department of Justice, they created the DEA, and the primary reason for that was to enforce the federal laws. All right. So that is mainly what you really want to know here, what the DEA does essentially. And then if you go down here to section 2, that is a very important section that you kind of want to linger on, because that is what tells you which controlled substances fall under what schedule. So really quickly here, I'm going to go over that for you. I'm going to give you some tips to how to remember, because you will get questions asked directly on which drug is under what schedule. And you don't want to get that wrong, because that should be one of the easy questions that you get. So Schedule 1 is mainly drugs that have very high potential of abuse, but they are not currently accepted as medical treatment. And what does that mean? So that means that basically whatever pharmacy you're working at, either if it's going to be like inpatient, outpatient, mail order, whatever pharmacy you're going to work at, you don't expect to get a prescription for heroin or LSD or cannabis, marijuana yet. So marijuana is still Schedule 1 medication. We don't know, maybe later it's gonna change to Schedule 2, but for now you want to know that marijuana is Schedule 1. Peyote and ecstasy, these are all Schedule 1 medication. They don't have any medical use. And then you go down to Schedule 2. So Schedule 2 here, it's at high potential for abuse for Schedule 1, and then Schedule 2, it says high potential of abuse as well. So it has the same high potential of abuse, but Schedule 2 medications are used medically for treatment. And it's good to know that Schedule 2 medications are further divided into narcotics and stimulants. All right, so Schedule 2 medications are not all narcotics. Some of them are narcotics and some of them are stimulants. So you want to know that. So Schedule 2 narcotics, we'll start with that. That includes mainly morphine and opium and their derivatives. So hydromorphone, which is, of course, you have to know the brand name for each one. So hydromorphone is Dilaudid, methadone is Dolofen, and we will talk specifically about methadone when we go to the narcotic treatment programs. We will speak about that, and you absolutely have to know if you can dispense that or not, when can you dispense it, who administers it, who writes it. You absolutely have to know that, and we will surely talk about that later on. But methadone is a Schedule 2 medication, and it's used for two purposes. So it can either be used for pain management, or it can be used for narcotic treatment programs for those who have drug abuse, or those who are trying to stop, abuse of narcotics. So these are mainly the two uses for methadone. And then we have Meperidine, brand name Demerol. Oxycodone comes in many brand names, so in combinations like Percocet, Percodan, and then as an extended release, which is OxyContin. And then the fentanyl. Fentanyl has a lot of brand names, so Sublimase, Duragesic patches. And then we also have the Actic, that's usually used for cancer patients. It's a lollipop, and many other more. The Inosys, which is usually used inpatient. You probably won't see that in an outpatient, but you probably want to know the brand names for that. If you had taken the Naplex, that kind of will be easy because you've already supposedly learned the brand names from the Naplex. But if you have not yet, you might want to check the brand names, because you can get brand names that are outside these options. So you might want to know that. All right, so that is for the narcotics, but then also Schedule 2 can come with stimulants. So stimulants are basically medications like amphetamine, dexamphetamine, methamphetamine, but that's not really used here. I'm not sure what that here, but you wouldn't know the brand names. Methylphenidate, Ritalin, and then look here, cocaine as a Schedule 2 medications. Many people don't know that, so you want to make sure that you know that cocaine is actually Schedule 2 medications. So cocaine is under Schedule 2, and then barbiturates. Barbiturates are actually they vary. So barbiturates can be Schedule 2, Schedule 3, or Schedule 4. And why do they vary? Why are barbiturates in these different scheduled substances? Why are they in different categories? It always depends on the onset. The faster the onset of a medication is, specifically with these controlled substances, the faster they give the feeling of euphoria and that feeling that gets abused. The faster you do that, the more addictive that medication is. And so if you think of it that way, you would understand why some barbiturates are actually under Schedule 2. So amobarbital, brand name Amital, pentobarbital, brand name Nembutal, and then secobarbital, which is Secbutal. These three are Schedule 2 medications. And why is that? It's because, like I said, they have a fast onset of action. And so they give that good feeling of euphoria quickly. And that's what people who abuse drugs like. They want to get that feeling quickly. And so that is why these three barbiturates are Schedule 2. So amobarbital, pentobarbital, and secobarbital, these three are Schedule 2 medications. And just remember that. Because later on, when we go to Schedule 3, controlled substances, there is another barbiturate, but it's in Schedule 3, and that is butalbital. That is a Schedule 3 controlled substance because it gives a slower onset to relative to amobarbital and pentobarbital, but a faster onset relative to another barbiturate that is in Schedule 4, which is phenobarbital. All right, so barbiturates can be Schedule 2 medication like amobarbital, pentobarbital, secobarbital, can be a Schedule 3 medication like butalbital, and it can be a Schedule 4 medication like phenobarbital, and that's what we'll be talking about later on. When we speak about Schedule 3 medications, it's always good to remember that Schedule 3 medications, there are not a lot of drugs that are in there, but each drug that is in there has a story behind it, and you kind of want to, remember the tricks because that is something that can be a testable question. So we'll start off first with codeine. So codeine alone, if you take a codeine tablet alone, not in a combination, absolutely is a Schedule 2. All right, so any codeine 5 milligram, codeine 10 milligram tablet. These are all assumingly, I'm just throwing in any number here, but codeine tablet, that is a Schedule 2 medication. All right, because it's related to hydrocodone. If you want to remember it that way, they're kind of it's different molecule, but it's the same family kind of. So oxycodone, hydrocodone, codeine, these are all Schedule 2 medications. But then if you take the codeine and you throw it in a combination with something else, which is mainly usually the acetaminophen or Tylenol. So Tylenol with codeine, as known in the pharmacy as Tylenol number 3, Tylenol number 4. We see that in prescriptions. Tylenol with codeine, that is Schedule 3, but only under something that you really want to remember. It has to be 90 milligrams of codeine in that tablet in one dosage unit or less. So one tablet of Tylenol with codeine must carry 90 milligram, or it must contain 90 milligram or less of codeine in order for it to be a Schedule 3 medication. If it has more than 90 milligrams in that tablet, then it's no longer considered a Schedule 3. All right, so it has to be 90 milligram or less for one dosage unit, and that's what it said right here. All right, so 90 milligrams of codeine per dosage unit of Tylenol with codeine. That's the brand name here. Also, what it doesn't mention here in the DEA manual, that also it has to have, if it's a Schedule 3 medication, if it's a liquid form, it has to have 1.8 gram of codeine per 100 mLs. All right. So these two numbers you need to remember. So 90 milligram if it's a solid form, 90 milligram of codeine per dosage unit. If it's a liquid form, 1.8 gram per 100 ml of codeine. All right, now of course both of them are in combinations. You want to remember that. A trick to remembering that is that usually numbers that are divisible by 3 apply to that rule of a product being a Schedule 3 medication. So 90 divided by 3, it is divisible. 90 divided by 3 would be 30, so it is divisible by 3, so you're good to go. So that's a Schedule 3 medication. 1.8 gram is divisible by 3, so you're good to go. So that is a good trick to remember if a medication is a Schedule 3 or not. Now, one thing that I want to mention here, if they want to trick you and they give you a product, so usually the questions are in the form like a product with 15 milligrams per 5 ml combination Tylenol with codeine, what schedule is that? So here I'm gonna open the calculator here, and you will want to do the math. So if it's 15 milligram per 5 ml, so you need to see how much it's gonna be in 100. So 15 times 100 divided by 5 for the crisscross, and that would be 300 milligram per 100 milliliter. And then remember that you have to change that to grams. So that will be, so basically that combination is 0.3 grams per 100 ml. So you have to do the math and see how much it's going to be per 100 ml, so you can compare that to the number that you know by heart by now, which is a combination of codeine with Tylenol would be a Schedule 3 medication if it's a liquid form, if it carries 1.8 gram of codeine per 100 ml. Here, it's less than 1.8, so it's divisible by 3. It's less than 1.8, so it's screaming at you. That is going to be a Schedule 3 medication. All right. So that is the first trick to remember about Schedule 3 medications for codeine. The next thing I want to mention is buprenorphine is another Schedule 3 medication. Buprenorphine is usually present alone. So Subutex, which is no longer, it's discontinued. That's the brand name of buprenorphine. And then we have Suboxone, which is a combination of buprenorphine with naloxone, and that's usually used for opioid dependency. So buprenorphine, just like methadone, we mentioned above here, buprenorphine, like methadone, also has 2 uses. So buprenorphine can be used for pain management, and it can be used for opioid dependence, to treat opioid dependence. So this is the other medication that has 2 uses, and you always have to know as a pharmacist why the doctor prescribed that medication specifically, and we're going to be talking about that later on in details. All right, so that is the second medication that is a Schedule 3. Also, you want to know another medication that is actually not written here in the manual, and that medication is called Xyrem. Xyrem is a medication that has only one medical use, and that is narcolepsy with cataplexy. right? So what does narcolepsy mean? Narcolepsy means that while you're sitting randomly in a bus station, at work, anywhere, you'd fall asleep, right? So you'd just fall asleep right away. And you'd lose cataplexy. You're losing your muscle control. So narcolepsy with cataplexy, people with narcolepsy and cataplexy are people who fall asleep at random times. They can be sitting eating dinner and they would just fall asleep. And then with cataplexy means that they would lose their muscle control. So they completely go, they fall off the table. They just lose their muscle control. So that is the only use that is usually prescribed. Xyrem is only prescribed for that use. And it's very important to know that Xyrem, if used for that special medical use, it's a Control 3 medication. However, Xyrem is a brand name generic for sodium oxybulate, and that generic actually alone is controlled 1 medication, which is alpha GHB, and that is actually a date rape drug. So it's a controlled 1 medication, doesn't have any uses. If it's not used for narcolepsy with cataplexy, same chemical structure, but used for something else. They're narcolepsy, cataplexy. It's popular use as a controlled 1 medication for date rape because it makes you fall asleep. So that's another thing that you want to remember for Schedule 3. Right, and then of course testosterone steroids are Schedule 3 medication. Ketamine is a Schedule 3 medication. So it's a hallucinogen. So these are all Schedule 3 medications. So you want to remember Schedule 3 medication, and that way there's a point to remember in every Schedule 3 medication that I mentioned here. All right, so that is the Schedule 3 medication. And then Schedule 4 medication are medications that have low potential of abuse relative to substances in Schedule 3. So as you go down, the potential of abuse decreases essentially. And Schedule 4 medications are usually medications that are either benzodiazepines or the Z drugs, right? So when you see a benzodiazepine or a Z drug, you automatically think that's a Schedule 4 medication. And propoxyphene, which is brand name for Darvon. All right, so the trick here is just to remember the brand names. So you want to, of course, almost everyone knows alprazolam, brand name Xanax, clonazepam, Klonopin, but then there are some things that are maybe you might not be aware of, like clorazepate, brand name Tranxin, midazolam, brand name Versed. So you might want to remember the brand names because you'll be expected to know these in the MPJE. You might get questions for the brand name specifically. All right. And then lastly, Schedule 5 controlled substances have the lowest potential of abuse. Now, Schedule 5 substances are mainly examples for that. Mainly, we want to think of cough syrups that contain codeine, like Robitussin contains codeine, Phenergan with codeine. So these are all Schedule 5 substances. And then you also have these random Schedule 5 controlled substances out there. So if you've been preparing for NAPLEX, you know that lacosamide, or Vimpat brand name for lacosamide, that's a Schedule 5 medication. You probably know that pregabalin or Lyrica is a Schedule 5 medication because they do have one of their side effects is slight euphoria. So the DEA chose to put them as a Schedule 5 medication. So you do have some Schedule 5 medication that will be random from all around the drug arena. So you might want to put that in mind. And propranolol, these are all Schedule 5 medications. So that is the end of the controlled substances. One thing I want to mention here before I end this video and then meet you in the next video is that Schedule 5 controlled substances per federal law can be given over the counter. So or to be more specifically, can be given without a prescription. So not really over the counter, it does have some regulations, just like the pseudoephedrine. So basically, you will need to sign a log before dispensing or before giving that medication, but it doesn't essentially need a prescription. But that is with federal law. So you don't need a prescription, doesn't expire, all that. So it's basically treated like an over-the-counter, but it's really behind the counter because you will need a pharmacist to sign the log sheet before you get the medication. However, like I mentioned, with the strict laws, you always follow the more stringent law. Here in Washington, we don't usually dispense or distribute Schedule 5 medications. We usually get a prescription for it, and that is because the Pharmacy Commission here in Washington stated that in order to dispense Schedule 5 medication, it has to be for medical purposes. And so that kind of restricts the fact that Schedule 5 can be just distributed over the counter because it has to be for a medical purpose. But however, the Pharmacy Commission did not really mention the fact that you have to have a prescription in order to dispense that medication. And so to be on the safe side, pharmacies here in Washington, they don't really dispense, or they don't really give out Schedule 5 medications without a prescription. So that is a tricky thing. I think it's interesting a bit to know that or be aware of that. I'm not sure if you get a question about Schedule 5 medication, if they can be dispensed or not without a prescription, since the rules here are a bit vague. But that is something interesting to note about Schedule 5 medications. And then before I end the video, I would like to mention regarding prescriptions for these medications. So Schedule 2 medications here in federal law actually states that Schedule 2 prescriptions do not expire. However, here in the state of Washington, Schedule 2 medication expire in 6 months. So if it's written on January, it would expire 6 months after. So January 1, it would expire 6 months after in June. All right, so Schedule 2 medication per federal law does not expire, but per the state of Washington, it does expire. Schedule 3, 4, and 5 per state of Washington rules expire also in 6 months, or you can give a maximum of 5 refills, so whatever comes first. All right, so Schedule 3 and 4, they both have the same federal laws and the same Washington state law. They both match. However, the only difference between federal law and state of Washington law is usually with Schedule 2 regarding the expiry. So like I said, federal law says that Schedule 2 prescriptions do not expire, but in Washington, they do expire in 6 months. And then, like I mentioned earlier, the other difference is that federal law states that Schedule 5 can be given without a prescription. And of course, you would think that they wouldn't have refills. That would make sense because they're not given with a prescription. However, with Washington state law, Schedule 5 is treated just like any other scheduled medication. It expires in 6 months. You need a prescription, and it's either 5 refills or 6 months, whatever comes first. All right, and this would end the first part of this video. Thanks for watching, and when you come back, we will continue with the other sections in the DEA manual. All right?